Welcome everyone, and thank you for joining us. My name is Natasha Musavi, and I'm AAPI's Associate Director of Online Learning. I'll be assisting with today's webinar. Before we get started, I would like to go over a few items for our participants. This presentation is being recorded and will be available within your AAPIC Education Online account within 48 hours. We will notify all members once it is available. We would like you to submit your questions at any time during the presentation using the Q&A tab at the bottom of your screen. If you need technical assistance at any time, please note the chat box is being monitored by AAPIC staff. Please let us know through the chat box or send an email to elearning@aapic.org. It is now my pleasure to introduce Suzanne Davis, AAPIC's Associate Director of Grants and Business Development. Suzanne, welcome to the program.
Good afternoon. Thank you so much, Natasha. It's a pleasure to be here. And good afternoon to everyone. Welcome to this informational session, AAPIC Strategies for Building Infection-Safe Communities. I'm Suzanne Davis, AAPIC's Associate Director of Grants and Business Development, and I'm so glad that you've been able to take time out of your day to join me to learn more about how AAPIC can partner with states and other organizations to meet their specific infection prevention and control, or IPC, needs. As our nation and the world continue to struggle with COVID-19 and surging rates of healthcare-associated infections, or HAIs, left in the wake of this deadly pandemic, AAPIC, the Association for Professionals in Infection Control and Epidemiology, has designed a playbook of strategies to inform and guide state-level efforts. Through collective action and smart investments, states can now act to build infection-safe communities. As we cross the 2-year mark of managing COVID-19 in the US, now is the time to not only invest in infection prevention and control to help combat the pandemic, but also to build a proactive response capability so that states can be prepared with the resources and infrastructure they need to help to keep people healthier, schools open, and the economy moving. As states consider action steps to bolster their infection prevention efforts, it's critical that a holistic approach be taken. Infection prevention is everyone's business, as we invest in our infection-safe communities, we must address all aspects that impact our readiness, including ensuring adequate healthcare professional staffing levels, addressing limited supply chains, and ensuring that all stakeholders have the knowledge they need to support IPC efforts. As the world's largest professional association of IPC professionals, AAPIC is a trusted resource. AAPIC's breadth of knowledge and resources position it to assist states in meeting the urgent need for infection prevention across settings. Building infection-safe communities requires smart investment in IPC infrastructure. As the national leader in IPC, with direct access to the largest network of IPC experts, AAPIC is here to partner with you to design and implement programs through federal and grant funding mechanisms. So I'm going to take some time to walk you through the State Infection Prevention and Control Strategies Playbook, which includes 5 strategies to inform and guide state-level efforts and provide guidance on how AAPIC can help partner with states to implement these strategies. The strategies playbook is also available on our website at aapic.org/building-infection-safe communities. Please note that we'll leave time at the end of the presentation for questions and answers. As a reminder, we encourage you to submit your questions at any time into the Q&A box. We'll start with strategy 1, protect the safety of our long-term care residents. Build mandatory training of all long-term care healthcare personnel on foundational IPC practices. Ensuring a well-trained workforce is crucial to keeping residents of long-term care facilities safe from infection and to building processes to rapidly respond when needed. AAPIC offers a variety of online, in-person, and virtual training that can be tailored to meet the needs of your long-term care workforce and ensure that they are equipped with the most up-to-date IPC knowledge, skills, and abilities. Second, deploy and train dedicated infection preventionists, or IPs, in all long-term care facilities. Requiring all long-term facilities To have a dedicated infection preventionist with specialized IPC training is crucial to keeping our long-term care community safe. In partnership with AAPI, states can help evaluate their long-term care IPC programs, assess gaps, and develop training solutions to help build the IPC workforce bench strength needed to help keep long-term care communities safe. In addition, AAPI Consulting offers on-site or remote interim IPs to serve as additional capacity or mentors for long-term care IPC staff. Next, strategy 2, build a sustainable and scalable statewide infection prevention workforce. First, build a statewide apprenticeship program for new IPs. Developing a pipeline to ensure that states have sufficient access to an IP workforce is crucial to building the backbone of states' infrastructure to prepare and respond to outbreaks. Finding well-trained IPs has become challenging as organizations work to keep up with demand. Utilizing the national standard for apprenticeships, AAPI can assist states in developing their own programs to train new IPs quickly and ensure that they have the knowledge and skills they need for success. Second, develop a preceptor matching service to match IPs to job sites. A common challenge reported among state health departments is that they want to ensure their IPs have had a wide set of experiences. Building a program that matches new IPs with preceptor sites to help them build this experience is crucial. AAPI will work with state health departments to develop a program to help match sites with new IPs and ensure that IPs have the breadth of knowledge they need to be successful in public health. Continuing with strategy 2, ensure a common level of expertise among IPs by funding training programs and certification. A cornerstone to an infection-safe community is ensuring ready access to highly trained IPC talent. States can work to build this infrastructure by investing in training for IPs and providing scholarships to become board certified in their profession through achieving their CIC designation through CIVIC in partnership with AAPI and its network of chapters across the US. States can work to offer training courses on a variety of topics and can build grant programs to fund certification of the state's IP workforce. Fund pilot projects for local colleges to offer degree and non-degree IPC programs. Building infrastructure to support the training and development of new IPs is at the cornerstone to ensuring that communities have enough IPs to support their communities. Through demonstration projects and pilots, states can fund colleges to create new programs that can build a pipeline for new talent to support expanding IPC workforce needs. These programs could be designed as certificate programs, apprenticeships, or graduate and undergraduate degrees. AAPI can partner with local colleges on helping to design and optimize curriculum by aligning it with our nationwide infection prevention academic pathway. Next, on to strategy 3, protect our children, build school-based IPC infrastructure. In early 2021, AAPI, in partnership with other leading healthcare and education organizations, developed a national framework for building IPC teams in schools to help prevent and respond to outbreaks. States can partner with AAPI to offer both in-person and virtual training and technical assistance to help develop statewide programs to build IPC teams to keep our academic communities safe. Strategy 4, ensure IPC infrastructure exists in prisons. Prisons pose a unique challenge for states as the environments are built on congregate living conditions and proximity between large groups of individuals. These conditions can make the prevention and control of infections challenging. In partnership with AAPI, states can invest in ensuring that trained IPs are made available to the prison system and building training programs tailored to each prison staff to teach prison staff on preventing and managing infections. And finally, on strategy 5, build statewide IPC network and technical assistance programs. First, deploy IPC experts who can serve as advisors to state agencies in program design and development. Access to IPC expertise and guidance is a necessity to help strengthen our community's ability to prepare and respond to outbreaks. State agencies can partner with AAPI to develop technical assistance programs statewide to help provide advice and counsel to organizations to ensure that all agencies have access to the knowledge they need for success. Next, partner with healthcare organizations to assess and optimize staffing ratios for staff that maintain infection-safe environments. These include IPs, nurses, environmental services personnel, among others. Building an infection-safe environment is a collective effort that centers not only on the role of the IP, but also on other key healthcare and non-healthcare professionals. States can fund healthcare organizations to evaluate their staffing ratios to ensure that organizations are properly staffed to prevent and respond to infections. AAPI Consulting can partner with states to serve as a partner with healthcare organizations in reviewing their staffing ratios and provide expert guidance on how to optimize them. Next, conduct state-level programming to train IPs and conduct facility-level training of frontline personnel on the basics of IPC. Access to online and in-person or virtual learning within all 50 states is a crucial part of building infection-safe communities. Working with AAPI, states can design a continuous training program within their state to ensure that IPC personnel and all frontline workers have the knowledge they need to prevent and control infections. Next, promote certification of IPs. This includes promoting the development and recognition of IPC experts by supporting IPs to obtain their certification in infection control or CIC designation through review courses, support for exam preparation, and exam registration. Additionally, next is fund access to the latest resources to support IPC efforts. Enable healthcare providers and organizations to access high-quality IPC materials. AAPIC publishes the AAPIC Text of Infection Control and Epidemiology, a comprehensive peer-reviewed reference work for IPC across settings, in addition to a series of setting-specific guides and infection-specific resource guides. Moving on, we can develop state IPC quality improvement collaboratives. One critical challenge during COVID-19 was the difficulty in containing HAIs. Nationwide, HAIs surged 40% while organizations were addressing COVID-19. While the reasons are understood, the reality remains that across all states, there is significant work to be done to turn the tide on addressing infections inside and outside healthcare facilities. AAPIC can help develop statewide quality collaboratives to train professionals on data collection, application of surveillance criteria, and data reporting. Next, fund facility-level technical assistance consultations to help states build evidence-based IPC practices. Ensuring that all facilities have access to the latest in IPC best practices, policies, and procedures is crucial to preventing and controlling infections. In partnership with AAPIC and its chapters, states can develop state-level networks of IPC specialists that can assist facilities to help review their current operating status and provide guidance on improvement. So that wraps up the 5 strategies for state infection prevention and control. We also wanted to follow up and provide information on currently available education and training solutions. AAPIC offers a customized group training at a discounted rate for groups of 30 or more individuals. These courses may be delivered in person or virtually and are customized to meet your specific group's needs. All AAPIC trainings are led by CIC certified infection preventionists with 15 or more years of experience in the infection prevention and control field. Some examples of training that we currently offer include the EPI Intensive program, which is a 4-day intensive training that covers the fundamentals of IPC. We also offer CIC certification preparation courses, including the 1-day CIC Power Prep, as well as the 4-day CIC Prep course. Please note that the 4-day course is currently under revision and will be available later this year by Q3 or Q4 at the latest. If you would like information on that, feel free to reach out. We also offer the EPI in Long-Term Care series, which is an intensive 4-day workshop specific to the long-term care setting. And finally, we also offer the ambulatory surgery centers and outpatient clinics/services intensive training, which is also a 4-day intensive workshop specific to the ASC setting. These intensive courses result in a certificate of completion following successful completion of all course components. Next, I wanted to share that APIC also offers training bundles, which means that you can choose training plus membership or other APIC resources at a discounted rate for groups of 30 or more. If you're interested in learning more about membership, the website is apic.org/member-services/about-membership. And some membership benefits that I'm happy to share information on include on-the-job support and education, research and thought leadership, such as access to our monthly publication, American Journal of Infection Control, AJIC, and the quarterly Prevention Strategist magazine. Membership also brings options for career partner resources and opportunities for networking and community through resources such as IP Talk, which is APIC's member-only online community, which is a very active online community. With training, you can also choose to bundle other resources such as APIC Text, which is the most comprehensive reference for infection prevention and control. Written and edited and reviewed by experts, the APIC Text reflects the latest guidelines, regulations, and standards of practice. And within that, there are options to bundle individual or institutional subscriptions. You can also choose to bundle curated chapter collections. Additionally, there's the option to add any APIC publications along with training as part of a bundle, and we offer that as well as at a group discount. Some of the more popular options for bundling training and publications are the CIC prep training bundled with the certification study guide, or the EPI in Long-Term Care series bundled with the Infection Prevention Guide to Long-Term Care, as well as the ASC training plus the IPC Essentials for Ambulatory Care workbook. There's a lot more information in APIC's eStore, which I did provide a link to, and we'll be happy to follow up if you would like more information on any of those training bundles. Next, I wanted to share some information about APIC's online training. We offer an extensive library of online learning options and solutions, and just a few examples of those courses are contained within the slide. They include EPI Education Series Online, the Fundamentals of Infection Surveillance, Prevention and Control, Infection Prevention and Control Essentials for Ambulatory Care, Infection Prevention Certification Review Course, Long-Term Care Infection Preventionist Essentials, Infectious Diseases and Pathogens, Leadership and Management in Infection Prevention. And then we have a couple of different EPI education series. One is Cleaning, Disinfection, and Sterilization in the Surgical Setting. And another example is the Basic Microbiology for Infection Preventionists. Again, we've provided a link, which is apic.org/education-and-events/online-learning. These, again, are just some examples of online courses. Please do visit the website or feel free to reach out if you have questions about online training. And I do want to take a quick moment to just share with you all that APIC essentially offers consistently solid content and curriculum across the different modalities. Essentially, if you determine that your learners are better suited to online training versus group training, which is considered live, instructor-led, in-person or virtual training, essentially you'll receive good content. We just want to help you find the right training solution through the right delivery method for your group. Next, I just provided a few examples of bundled learning options. In this case, you would have the option of bundling online learning with various publications. And by doing so, you'll save 10% over purchasing these items individually. Some examples of the bundled learning options are Advance Your Practice online series, Basics of IPC for new IPs bundle, Certification Preparation and Review bundle, Infection Prevention and Long-Term Care bundle, and the Construction and Renovation for IPs bundle. Again, we've provided the website for more information on training bundles, and that's apic.org/education-and-events/bundled-learning-options. Finally, I just want to share that APIC is here to help. You're welcome to contact Catherine Stearns at cstearns@apic.org, or feel free to reach out to me, Suzanne Davis, at sdavis@apic.org, or you can give me a call at 202-292-5015. And we'd be happy to connect with you to discuss how APIC can partner with your state to build infection-safe communities. And now I'm happy to open up the floor for any questions that you all might have.
Thank you, Suzanne. Yes, audience members, as a reminder, to submit your questions, please use the Q&A box at the bottom of your screen. All questions will remain anonymous as well. All right, Suzanne, looks like we have a few questions ready to go, so I'll just dive right in. Our first question is, what are next steps if my state is interested in exploring solutions with APIC?
Great question. Thanks, Natasha. I would welcome anyone who's interested in learning more to reach out to me or Catherine or both of us, and we're happy to schedule a meeting with you to discuss what IPC needs your state might have and how APIC can partner with you to develop custom solutions or to provide more information on APIC training and education. We find for the most part that these individual conversations are really helpful, both so that we can understand what your needs are and so that we can help find the right solutions for you. So please do reach out.
Sounds great, thank you. And just kind of another question specific to what we just asked. So maybe overall, how long do you think it will take APIC to develop a proposal?
Another great question, thanks. Essentially, following a meeting, once we've determined what your state's needs might be, or any organization who requires infection prevention and control solutioning, we put together a proposal which usually gets turned around within a week or so, depending on what else is going on around that time. And then you can expect that solutions can be delivered within the next 4 to 6 weeks. Particularly training, if that's what you're interested in, does take some time to develop and coordinate internally with our faculty, subject matter experts, and other staff who are busy putting training together for you.
Sounds great, thank you. Looks like we have a couple more questions. So the next question is there a better season or quarter, perhaps for APIC to implement training in our facility?
Excellent question, which actually speaks to the influx of requests that we are receiving, which is wonderful, and we're happy to accommodate. Essentially, we do keep a calendar of training, and although there isn't really upfront an ideal case scenario, unless you are looking for the 4-day CIC preparation course, which we would look at delivering by the third quarter or later this year. But essentially, we are willing and able and happy to coordinate with each facility or state to understand what your needs are. We can look, through your top 3 options of when, explore your top 3 choices for when to deliver training, and make sure that we have faculty and staff available to lead the training, that the content is up to date and meets your requirements. And essentially, we find a time that is mutually workable for both APIC and your organization. So essentially, we can make it work whenever you need it.
Sounds wonderful. Thank you, Suzanne. All right, if there's nothing else, it looks like we're all caught up on our questions at this time. Do you have any closing comments before we go ahead and wrap up the session today?
Essentially, just want to remind everyone that we're here to help. Feel free again to reach out to me or to Catherine. I'm at sdavis@apic.org, and Catherine is at cstearns@apic.org. We would be happy to connect with you to schedule a time to meet and explore options and help find solutions to meet your state's IPC needs. So please do be in touch.
A special thank you to our presenter, Suzanne Davis, and to everyone who participated in this program. The on-demand recording, along with the presentation slides, will be available within 48 hours. This concludes today's program. Thank you all. You may now disconnect.